Real-time vitals. DSS's real-time vitals will directly input patients' vitals into Vista CPRS via a vital signs monitor in real time. Automatically import patient vitals such as blood pressure, SpO2, pulse, and temperature. Accurate patient information is immediately viewable to clinicians within CPRS. Patient vitals are placed directly into CPRS from RTV, ensuring data integrity. This will save time while making rounds, as well as reduce or eliminate the possibility of improperly transcribing data. DSS is vendor neutral. RTV interfaces with the following vital signs monitors: the CASMed 740, Welch Allyn's 52300, and the Spot LXI, Criticare's 506N3, and Omron's Prodigy. We are also vendor neutral when it comes to charting solutions. Currently, Flow Healthcare and Rio Vision are the two vendors we work with. Let's talk about the RTV vitals capture process. The first thing you do is select. There are two methods of selecting a patient. You can either automatically retrieve the patient identifiers by scanning the patient's wristband by using a barcode scanner, simply scan the patient's barcode on their wristband. On the DSS RTV screen, the patient's name will appear at the top. The other way of selecting a patient is to manually search for a patient using the Patient Select screen. Enter in the patient criteria in the search text box. Any patients meeting that search criteria will appear here in the list. Select the patient by simply clicking on the name in the list. Basic demographic information will appear on the right-hand side of the screen, so that way you can ensure you have selected the correct patient. The last step is to click on the OK button. The DSS RTV screen will appear with the patient's name at the top and bottom of the screen. The next step is to connect the patient to the vital signs monitor and to simply take the patient's vitals. Patient vitals are read from the vital signs monitor and pulled into the real-time vitals program in real time. The next step, the user clicks on the Save Now button. If the qualifier screen is enabled, it will appear next. Users can notate any qualifiers with the vital signs such as location, method, and position. Simply click on the drop-down arrow for each qualifier and choose the appropriate answer. Some qualifiers are text boxes. Enter the amount using the keyboard or use the up and down arrow buttons. Users can also enter if the patient is experiencing any pain at the time of vital collection via the pain scale button. Users can also manually enter respiration, height, weight, and girth information too. When you are finished with the qualifier screen, click on the OK button to save the information to the patient's chart within CPRS. RTV will display a green bar towards the top of the screen, alerting the user the vitals have been saved. The RTV process is a three-step process. You select the patient, take the patient's vitals, and click on the Save Now button. It really is that easy. Once saved, the RTV vital information will appear in the Vital section of the cover sheet within CPRS. If you would like more information about real-time vitals, please contact your DSS Inc. sales representative. Thank you.